It's important to reassure patients as much as possible and to sell preconceived notions there might be about metastatic breast cancer being a death sentence, which it really is not anymore. And patients are living with the disease in many cases for a long period of time. We think of it more as a chronic disease. That's not true in every single case, but many patients with metastatic breast cancer can live good quantity and quality of lives. We have great treatment for it. There's sometimes some misconception about, for example, if someone has metastatic breast cancer that's spread to the lung, that is not the same thing as a lung cancer that actually starts in the lung. And the cells under the microscope look very different. So the cells look like the original breast cancer cells that started in the breast. And what can happen is, even with best efforts to eradicate the disease locally and give therapy to treat any microscopic cells that might have traveled anywhere, is that there can just be one cell that's resistant to those therapies that can spread via small blood vessels or small lymphatic channels to another part of the body and take hold there and grow to a point where it's in some way clinically detectable. So unlike treatment for early stage breast cancer, where we give a defined length of time for treatment, the treatment of metastatic breast cancer is an indefinite period of time, and the way things work is that we choose a treatment for a patient for a period of time, usually repeat blood work and scans. If the treatment's working, we continue it indefinitely as long as it's either keeping the cancer from growing, shrinking the cancer, and as long as the patient is tolerating side effects. Some of the new treatments that we have work so well that it's certainly not unusual in this day and age to have patients get to a point where there's no evidence of their disease on scans or through blood work. And we keep them on whatever treatment is keeping things under control. And a lot of patients can do very well with metastatic disease and live many years, sometimes with good quality and quantity of life, do normal things, continue to work, go to bar mitzvahs and weddings, and live their lives. Patients are living, sometimes without evidence, disease for many years, more and more. We're seeing more and more of that.